Struggling with chronic ear infections? Well, this video is for you. So, if you are tired of endless nights of pain and tears, back to back rounds of antibiotics, and potentially the looming threat of surgery, and you're tired of band aid solutions and you're looking for the root cause, this video is for you. It's normal to get worried about when there's a little bit of congestion or a common cold. But when that turns into ear infections time and time again, it can be incredibly exhausting and frustrating. Ear infections create a lot of discomfort. It even wakes kids up, and it can feel like it's incredibly difficult to watch your child struggle and continue to pull and tug after their ears. It may even come along with some teething, and so you're watching your child go through a lot of struggle and discomfort, and you're looking to see how you can help them and give them some relief. Well, it's estimated by the age of 3, 80 to 90% of kids will have had at least one ear infection. Now, it's about 1 out of 10 kids will not get ear infections. So, what is the answer into why they're not getting ear infections? And what's contributing to the fact that almost 90% of kids are going to get at least one ear infection? But really, ultimately, this video is for kiddos who continue on this cycle of chronic ear infections. And so it's not one ear infection. It's we're continuing. We've maybe had multiple in a month. We're on antibiotics multiple times a year, and we have that looming threat of potentially tubes. So, what is going on, and how can you find relief? Well, what we're going to talk about is we're going to talk about a way to look at it where we look at the ears and we look at what's going on as a plumbing issue, a drainage issue that's linked to subluxations in the neck and in the cervical spine, and linking that to chronic ear infections and what's really going on, and how this chronic stress, and especially in the early stages of life that we talk about, can be contributing to why we're seeing this going on, and how chiropractic can help restore your child's the natural drainage and also help support their immune function. So I see kids with ear infections all the time. And so it's actually one of the most common things that kiddos come to chiropractic care for, because parents are in a place, especially with the chronic ear infections, they're on chronic antibiotics, then they tell them tubes are the only answer. And so that's when they're looking for an alternative option. And so that lands them oftentimes in chiropractic. And we have a great success rate with helping support kiddos in avoiding ear infections through, and why that chiropractic works, we're going to go into, but we have a great success rate, and it's so great being able to give support to these parents who are looking for an option. But it's one of the most common things that parents are saying, hey, we're exhausted and we're tired, we don't know where else to go. Somebody said this might help, and therefore we're here. And we are always so excited because we can really provide hope. Hope that a parent likely has maybe lost in the midst of such frequent ear infections, or just feeling confused and wondering if antibiotics and surgery are the only options. Now, one of the things when you get chronic ear infections, there are a couple different ways we can look at it. And so we're looking at building up the fluid. So when the fluid stays stagnant or it can't drain, it gives an opportunity for the bacteria to multiply, to create the infection. And that's why antibiotics are used as a treatment, because it's a bacterial infection. And there are other ones besides for bacterial infections. There's viral ear infections, but when you're using antibiotics, that's what you're looking for. Is you're saying that it's bacterial in nature. So but what is giving the bacteria the opportunity to create the infection? And that is a buildup in fluid, where the fluid is staying stagnant. So we know that the tubes in the ear for kids are more horizontal than they are vertical, which means that when we have a backup of fluid and the tubes are more like this, essentially it's going to create stagnance. And so we're going to back up the fluid. We're not draining properly. The fluid's staying stagnant, and then the bacteria has opportunity to multiply. And so that's why when we see this backup or buildup of fluids, we're saying, okay, we need to get this draining, or we need to address this plumbing or drainage problem. So, what is contributing to a plumbing or drainage problem? And that comes from as a result of misalignments or subluxations in the upper neck or in the cervical spine. And what that's going to do is they're going to have more tension in the upper neck and in the cervical spine. But then also there's a muscle that goes around the ear tube. And when we have more tension, it's actually going to inhibit the drainage. So we want to be able to relax the muscles inside the ears, that the muscle is there to actually help support the drainage process, because the fluid would go from the ears into the sinuses through the lymphatic system. And so the muscle is there to keep that fluid moving. But when it's too tense or we have too much tension there, then it actually is unable to keep that fluid moving and actually contributes to the fluid staying stagnant or backing up. So when we adjust to decrease tension in the upper neck and in the ears, we're able to allow for more fluid drainage. We know that that's also directly related to tension in the jaw. So these kiddos may also be experiencing teething or may have previously had difficulties with latch, or even at some point, maybe infant torticollis, which is when they're stuck to one side, or the lack of range of motion in their neck, because all of those things are indicators that there's a lot of tension in this area. Now, that's when we want to actually get the fluid moving. So we actually release the ears, but we also do some gentle adjustments on the cervical spine so that we can eliminate any tension in those muscles so the muscles can work properly in getting everything moving. The next thing that we're going to focus on is we're focusing on when that tension or there's misalignments, it's also contributed to inflammation. So, when we're looking at inflammation, oftentimes inflammation is linked to maybe food allergies or diet or environment, and that is absolutely true. We call that environmental toxins. But another thing that's going to contribute to this inflammation is when we've had recurrent ear infections, the body is going to be stuck in this state of fight or flight or stress. And that's because the body is constantly having to mount that immune system. And so, whenever there is a threat, it's going to trigger stress in the body. Now, the stress is designed to try to help you. So, when your immune system produces inflammation, for example, you sprain your ankle, your body is actually going to produce inflammation so that it can send nutrients and resources to start the healing process. But the problem is that when we've had recurrent ear infections, and this is also true in autoimmune conditions, when the immune system continues and then is attacking healthy cells, it really produces inflammation, and then that inflammation further contributes to the problem. And so instead of being acutely helpful, it becomes more of an issue chronically or long term. So, inflammation is helpful acutely or short term, it's not helpful long term. And so, when we've had these recurrent ear infections, our body is worn out, it's mounted this immune system multiple times. We're going to be in this sympathetic dominance or this fight or flight state. Now, often, what comes first, the chicken or the egg? Often, what comes first? Has it been a combination of maybe a high stress pregnancy, lots of birth interventions, mental and emotional stress, etc., that's contributed to a sympathetic state in baby? And now, because of that, we're seeing more inflammation and therefore a greater susceptibility to ear infections. Or is it that we're getting these chronic ear infections due to lack of drainage, and now the recurrent ear infections are triggering the sympathetic or the cortisol, and now we're seeing high inflammation because we keep getting sick? And so that's another thing we need to focus on. One, we want to drain, and then two, we want to help relax the body, because when we're in rest and digest, which is known as their parasympathetic nervous system, that's when we're able to heal, grow, develop, rest, restore, and regulate. And so in order for our body to truly be able to fight everything off and to really restore, we want to be able to give our body rest. And so it's twofold. We want to balance the nervous system, but then we also want to make sure the fluid's draining. And so that's what we really call double trouble, because it really is this twofold look at it and saying, hey, you know what, we can't ignore why is there the ear infection, and it's because of the fluid, but then at the same time, we want to make sure we're relaxing those muscles, allowing for drainage, and also allowing the body to heal. And the body heals from a place of rest and digest. Now, there are lots of other things that can stir the pot. Like we said, like there can be, more predisposed. Maybe we have higher levels of tension in the neck from maybe birth interventions. And like I said, that may have also been something we saw earlier on infant torticollis. There may be more food sensitivities or a higher level of inflammation. Especially, it's common for babies to have food sensitivity to dairy. And so maybe there's other things that, maybe sugar, etc., other things that are making it worse. And so we want to be able to make sure we're identifying that as well, that we're not contributing to just add on and stir the pot and make things worse, but we also want to make sure we address the root cause and what's going at it. Especially because when it comes to antibiotics, antibiotics are useful if there's a bacterial infection, but chronic use of antibiotics actually kills good bacteria and bad bacteria in the gut. And the gut, we know, is a huge part of the immune system. And so over time, the antibiotics can actually then contribute to damaging the immune system because we're on too frequent antibiotics. And then over time, we're looking into a lot of things on antibiotic resistance, etc. So the antibiotics are helpful if it's acute, the same way an inflammation is helpful if it's acute. Problem is when we start developing these chronic things or chronic conditions, and we really need to say, okay, if it keeps coming back and keeps coming back, how are we only addressing the tip of the iceberg and we're not getting to the root cause? So, those are just a few things on how chiropractic, especially neurologically focused chiropractic, can help your child with chronic ear infections. So, if your child is struggling and you are thinking that your last option is tubes, give chiropractic a try before and see how chiropractic can help your child. Look forward to meeting you and your kiddos soon.